Today, more than half of all people diagnosed with cancer survive for at least 5 years. Is that true or false? There are no warning signs with cancer. Illness tends to come on suddenly. Is that true or false? The greatest risk of breast cancer occurs at what age? Stay with us tonight for the answers to these questions and more as we learn more about the silent C, cancer, on tonight's Delore Factor Live.
The views expressed in this program are those of the host and guests and in no way represent those of DBS and are not intended to determine decision-making processes. Delore Factor Live is produced by Delia Delore Productions and Consultancy and sponsored by Paradise Water, EC Global Insurance, Quartz St. Lucia Limited, Infinity Color Shop, Ference Dairy, Star Publishing, Transit TV, Sea Island Cotton Shop, Chart House, Rodney Bay Medical Center, Ladera Resort.
Welcome to Delore Factor Live. I'm Delia Delore. Let's see how well you did with my opening questions. Today, more than half of all people diagnosed with cancer survive for at least 5 years. Is that true or false? It's true. Scientists have come to understand much more about what cancer is and how it grows. And there are no warning signs with cancer. Illness tends to come on suddenly. Is that true or false? The answer is false, but do you know why? Well, there are some symptoms that may indicate cancer, though there could also be symptoms of other diseases, and we're going to discuss this later. Now, the greatest risk of breast cancer occurs at what age? The answer is, although all women are at risk, a woman's risk of developing breast cancer increases with age. Now, as you all know, I'm not a doctor, but one of my guests tonight is, and she's going to help us understand what cancer is all about. Our guests tonight are Dr. Tanya Destan-Bobran and Stevie Theophane, cancer survivor and also Vice President from Faces of Cancer. And later we'll be joined by Dorothy Phillip, President of Faces of Cancer. Welcome, ladies.
Thank you.
Thank you. Well, I'm saying welcome to you, Doctor, but I like to think of you as our resident doctor, because every time we have something that is a health concern, I always like you to be here because I like the way you can explain things to people.
I'm certainly going to try tonight.
Good. And I know that cancer is something that, as we know, diabetes, cancer, you must see a lot of that coming through your surgery.
Well, I think I've been in practice for 21 years now, and in the past 5 years, I've certainly been inundated with cancer. And it's probably a factor of my patients getting older, I'm getting older, and probably some environmental issues as well. But it is frightening when you think that you have patients who you've been seeing for so many years, and then you see something that alerts you, and you think, oh my gosh, I hope it's not cancer. How am I going to tell them that? Because the patients sometimes actually become like family. I mean, I'm a family physician, and I look upon my patients as part of my extended family. A team approach to healthcare is how we look at it in our clinic, and we all look at my nurse practitioner in the office, the receptionist, everybody. They're part of our family. So when we get a diagnosis of cancer, it's really like somebody in my family has been diagnosed, and I go through sometimes the grieving process with them. So it has become increasingly difficult because we're seeing more and more of it.
Well, tonight that I'm hoping that our viewers will take some time to fully understand what cancer is, how it affects people, because I think sometimes people say cancer and they just have a one-track mind as to what it is. And if you ask them to explain it, you'd be surprised. They cannot explain it the way that you think they understand it. So tonight I'm hoping that people will have a better understanding, not just of cancer, but how to support persons who have cancer. cancer. So I want to say thank you so much for being with us tonight and for sharing. I know you later on you're going to be sharing some of your stories with us, and also, of course, what you do in Faces of Cancer. But thank you so much for being with us tonight. What are you hoping to get from tonight, Stevie?
I would like to get a message across to as many people as possible, because I believe that we need to educate our people here in St. Lucia, especially our women, our young women. Cancer is attacking younger women. Many of the young women that I meet through Faces of Cancer, when I speak to them about their breast examination, it's as if they don't know, or they're not bothered by it, or they don't care. You know, I said, well, you know, you're at an age where you have to start looking about your health and yourself. It's not just dressing nice. You have to take responsibility of your health. You have to start doing your breast examinations. You have to start going for your mammograms and so on and so forth, and the different tests that, you know, women are supposed to go for. And it's like,
you say all of this, but you know, although this may not be a good comparison, but I think of young people when they fall pregnant and they say, well, I didn't think it will happen to me.
Yeah.
You know, well, none of us want to know that we have any kind of disease that's, you know, going to hurt us. But, you know, prevention is the number one thing, isn't it, in life, prevention.
It is. But you know, when you're in your 20s, you feel like you have life at your feet, because really you're not going to think of illness. You're planning your future. You've probably just come from school or going into university. You may be planning on getting married, starting a family. You're not thinking of these deep issues. You know, your most pressing issue is probably if you're planning your wedding, or if you're pregnant, taking care of your family, taking care of the babies, balancing work and the family. So I mean, I'm not making excuses for young women, but I've also been there where, and I will admit it, where I've put a doctor's visit last because I had work, I had kids' activities, I had school, I had family commitments, and that particular day it was just too much, so I cancelled the appointment. Now that could have very well been the appointment where the doctor would have examined me, and I have a story to tell you, and that's part of it. Can
we tell the story a bit later?
Yeah.
Okay, great. Don't forget it.
Remind me.
I will. Now, let me just show you our painting tonight on set. This week is an original canvas. It's titled The Song of Solomon. It's by Nancy Cole. And this painting is available at the Inner Gallery, which is off the Bois de Wages Highway. So, The Song of Solomon, it's by Nancy Cole. So make sure you go to the Inner Gallery on the Bois de Wages Highway. There's lots of wonderful paintings there. And they're affordable too. People say to me, oh, is the gallery is expensive? Well, how do you know unless you go there? And also, you are supporting wonderful talent. Our artists need your talent, okay? They need your support, okay? So, of course, the Inner Gallery, St. Lucia's premier art and picture framing gallery, is located along the Bois de Wages Highway, and office space is also available for rent at the Inner Gallery building, all right? So you know where it is. So after the break, we're going to talk more about cancer, but I want to ask you another question whilst we're getting there. Now, most cancers are hereditary. Is that true or false? Most cancers are hereditary. We'll give you the answer after the break. See you soon.